When you sign up for Medicare prescription drug coverage and you purchase your meds for the first time, it could be a shocker to find out that you're responsible for the entire amount. Don't panic. That's simply because, for most coverage plans, you have what's referred to as a deductible. Let's briefly review what a deductible is by following the story of Catherine. Catherine just signed up for standard, or original, Medicare and a prescription drug insurance plan known as Medicare Part D. But wait. First, let's step back for a moment and ask, what is the purpose of drug coverage? All health insurance is mainly designed to protect you against unexpectedly large costs, and you get that protection by paying your monthly premiums. You can think of it as 3 levels of costs, and as your costs during a year get larger, you get bumped into the next higher level. At level 1, you pay for everything. When your expenses get to a certain point, then you enter level 2, where you and your insurer share the costs. And then, if your expenses hit the plan's cap, at that point you enter a level 3, where your insurance will cover everything further. When we talk about a deductible, we're referring to that first level, where you have to pay for your prescription drugs until you reach a certain dollar level. For Medicare Part D in 2022, that deductible is $480. Great! So let's get back to Catherine, who's looking forward to using her coverage for her diabetes medicine. She uses a brand-name drug called Lantus Solostar. She needs it every month, and under her plan, it costs $100 for a month's supply. So in January at the pharmacy, she pays $100. She realizes she's beneath the deductible amount, and so she has to pay everything. Then in February, the same. But notice how her amount of total out-of-pocket payments for the year is creeping up. She's getting closer to her deductible. In March, she's at $300, and in April, $400. Starting in May, it's different. Catherine exceeds her $480 deductible, and now she's into the phase where costs are being shared with the insurer. We are at level 2. During this phase, insurance covers 75% of everything, and Catherine only pays 25%. So her monthly payment now is only $25. She had to suck it up during the deductible period, but after that, her Part D insurance takes care of most of it. Everything keeps going well through September, when Catherine suddenly becomes ill and requires some very expensive drugs. Those drugs, in fact, cost around $14,000 per month. Well, some helpful news. Her insurance plan provides what's called catastrophic coverage. This corresponds to the level 3 we saw earlier. So, Catherine continues to pay 25% of her drug costs for a short time, but when she reaches her out-of-pocket maximum of $7,050, her plan pays everything else the rest of the year. As you can see, in November and December, Catherine pays nothing at all. Her drug expenses have gotten so high that she's entered the level where they pay. So now we're clear what a deductible is. Each year, in most plans, you have to pay for drugs yourself at first. But the plan protects you from huge unexpected costs, which makes it worth it. Thanks for watching. For more resources that can help you save time and money with your Medicare, be sure and visit us online at wisermedicare.com.